Perfect. Okay. So again, Yvette, thank you so much. Welcome everyone, and thank you so much for joining us today for this webinar that's titled Safeguarding Farm Worker Health Through Flu Vaccination Outreach and Promotion. My name is Sonia Lee, and I'll be helping to facilitate this webinar today. We're really excited that you're joining us today because we have a great group of guests who will be sharing their knowledge and expertise with you. And we're really hoping that at the end of this, you'll walk away with this better understanding of the flu vaccine, and ways that outreach really can help support this promotion and uptake of the flu vaccine, because in the end, we really do want to protect the health of farm workers and their families. Next slide. So just really quickly, for those who may not be familiar with Health Outreach Partners, or HOP, we're a national nonprofit. We're based in Oakland, California. We're really focused on access and health equity by really advocating for outreach, because we see the important role that outreach really plays in connecting to underserved communities, building that trust and relationships, as well as really, helping facilitate that access to care and other services. We do trainings, consultations, and provide a lot of resources, working with community health centers, primary care associations, and other safety net organizations, as well as in partnership with organizations like NCFH, which, like Yvette had mentioned, we've been working together for the past several years. So again, we thank you and appreciate this opportunity. And yeah, you see here, we have our website up there. I encourage you all to go take a look. We have a lot of good outreach resources there. Next slide. And then, here's the agenda for today. Like Yvette mentioned, we're here for about 90 minutes. So we're going to be going, through, first we're doing the welcome and intro, and then we'll go into an overview about the flu vaccine, prevention and treatment, all of that stuff, a real comprehensive overview. And then we'll start looking at, really the role that outreach plays in getting the information out there and building confidence and really connecting to farm worker communities. And then we'll also be considering how we can leverage some of the work that's already being done in a lot of countries of origin where farm workers are coming from. And this specifically will be focusing on Mexico. And then we want to hear from all of you. So we'll give you the chance. We'll have these breakout activities and consider some questions around outreach, what's working, and what are still some of those challenges that are out there. And then, we want to give you also the chance to ask some questions. And so we will have about 10 minutes near the end for question and answers with our guests. And then we'll close up and hopefully we'll show you, you can fill out the evaluation that we have for the session. Next slide. And then finally, these are the learning objectives that we've set forth for this webinar, for this learning session today. And you'll see, first of all, we're hoping that at the end of this, you all will walk away being able to really describe the seriousness of the flu, be able to explain the benefits of annual flu vaccination, and also identify ways that outreach can really promote flu vaccine confidence among farm worker communities. Next slide. So with that, what I want to do is introduce our speakers for today. Our first speaker is Cerise Murata, and Cerise is the Advocacy and Education Director at Vaccinate Your Family, where she's responsible for cultivating, empowering, mobilizing, and supporting this diverse network of patient advocates who've been personally impacted by vaccine preventable diseases, and really overseeing the development of educational programming. And so we're really excited that you're here and want to welcome you, Cerise. And then the next speaker we'll also be having is Laura Campos, and she is the Associate Project Manager Graduate Intern at Health Outreach Partners, where she brings over 7 years of public health experience in nutrition education, community health assessment, grant management, and other technical assistance. And she's currently completing her degree in the Master's of Public Health. So welcome, Laura. And then finally, our final speaker will be Dr. Laszlo Medeiros. And Dr. Medeiros, or Dr. Laszlo, is the Chief Medical Officer for Migrant Clinicians Network. He's responsible for the oversight of MCN clinical activities. Dr. Medeiros has received his MD and Master's in Public Health from the Tufts University of Medicine in 1993, worked in various countries around the world, as well as in health centers and hospitals here in the US. So welcome, Dr. Laszlo. So with that, I want to turn this over to Cerise, who will start with this overview about the flu.
Thank you, Sonia, and thank you so much for having me here today. We can go to the next slide, please. So just to level set, I want to talk a little bit and orient everyone on Vaccinate Your Family. So Vaccinate Your Family is a national nonprofit organization. We've been around for 30 years, so created back in 1991. And our mission is to protect people of all ages from vaccine-preventable diseases. In fact, one of our founders, the former First Lady of Arkansas, Betty Bumpers, these ladies that got together, Ms. Bumpers, as well as former First Lady Rosalind Carter, were very passionate about immunizations. And Ms. Bumpers actually worked with the Cooperative Extension Service of the University of Arkansas, which coincidentally empowered farmers, ranchers, and communities of all sizes to meet the challenges that they face, such as adapting to changing technology, improving nutrition and food safety, preparing for and responding to emergencies, and protecting our environment. So it's fitting that I'm here today, so many years later, speaking to you about influenza and flu vaccination. So our work at Vaccinate Your Family falls into a couple of different buckets, which I will briefly summarize as access, education, and policy. We really want to make sure that everyone who wants to get a life-saving vaccine can, meaning that they have access to science-based, accurate information that is culturally and linguistically appropriate, making sure that they have access to immunizations themselves, and making sure that we're also continuing to raise awareness about the importance of timely immunizations. And along with that, also advocating for strong policies that support immunization. Next slide, please. So we're going to start with an icebreaker today, and we have a true or false question, and we're going to launch a poll in a moment here, and we would like you to answer, can a flu shot give you the flu? So this is something that I know I have heard many times. I'm sure many of you have heard it many times. And it's something that we're constantly addressing in the world of public health. So go ahead, and I'll give everyone a few moments to answer the poll question, and then we'll see what the answers are. Okay, wonderful. 73% of you said false. That is correct. So next slide, please. We'll talk about that a little bit. So false, flu shots do not actually have the ability to make us sick. And let's talk a little bit more about why that is. So flu shots actually do not contain a live virus that can make you sick. Flu vaccines, flu shots contain an inactivated or dead virus, or sometimes no virus at all. So it's really impossible, biologically speaking, for them to make you sick. Some people can experience mild side effects after vaccination, just like with other vaccines. That could include a headache, soreness at the injection site, a fever, mild muscle aches, but that's actually your immune system kicking into gear, trying to defend us against future infections. So mild side effects from vaccination are really not as bad as an actual flu infection. Next slide, please. So let's talk about influenza, otherwise known as flu, and flu vaccination. I'm just going to share some general information, kind of soup to nuts on what we need to know about flu. Next slide, please. So before that, I want to actually share something personal about myself. So this little boy you see in front of you is actually my son, Joseph. And I was actually a scientist for many years, but I actually came to be a vaccine advocate and a flu expert following the loss of my son, Joseph. He actually lost his life to influenza at the age of 5 in 2009 during the H1N1 pandemic. So I just want to tell you a little bit about Joseph. He was 5 years old. He was healthy. He was attending kindergarten. He was a healthy, happy kid. He loved Star Wars and Spider-Man. And he particularly loved playing board games and puzzles. And his story, the story of his illness, I should say, began pretty innocently. He was in kindergarten, as I mentioned. He was riding the school bus and he threw up on the school bus. We brought him home. Later that day, his condition did kind of get a little bit worse. He continued to vomit. He had a fever. He became really lethargic. And I think that was actually what concerned us because he was really tired and we actually had trouble waking him up from a nap. So we contacted our pediatrician. They said to take him to our local urgent care, which we did. And while we were there, Joseph's blood oxygen level they found was really low. So they actually put him in an ambulance and we went to the local children's hospital. So he was admitted to the hospital that evening and initially diagnosed with pneumonia. And the test that they did for flu actually came back negative. And we know that those tests aren't always very conclusive, especially 13 years ago. But nonetheless, he had tested initially negative for influenza. So we were really concerned and focused on treating his pneumonia. So he was in the hospital, as any child in the hospital, going through a lot of tests while he was there. And after a couple of days into his hospital stay, the doctors came to us and said that Joseph had indicated that he tested positive for flu, which they said to us, not a big deal. It's the flu. We will go ahead and treat that along with all the other things that we are treating while he's here in the hospital. So Joseph's samples were actually sent out to the CDC because, again, it was during the 2009 H1N1 pandemic, and they needed to get a conclusive diagnosis of what type of flu did Joseph have. And so it did come back that he had H1N1 flu, which was the pandemic strain that year. And I distinctly remember talking with the doctors and them saying, not a big deal. Yes, it's H1N1, but we will treat this just like we treat any other flu. So again, just making sure that we're treating the pneumonia, we're treating the influenza. Joseph was in the hospital for a total of 10 days. And during most of that time, his condition was stable. And we were actually talking about going home. You know, what were we going to do to just monitor things when Joseph got released from the hospital? On the 9th day of Joseph's hospital stay, his blood pressure plummeted. And we actually went back to the ICU, the intensive care unit there at the Children's Hospital. They continued doing tests, and the doctors were really struggling to figure out what was going on with him. On the morning of October 18, 2009, as I stood by Joseph's bedside in the ICU, he suddenly coded, and the doctors and nurses attempted to save his life. They worked on him for over 30 minutes. Unfortunately, were unsuccessful in saving him. And I remember having a conversation with the doctor that day in the ICU, and she explained to me that Joseph had died from complications of H1N1 flu. And I was at that time completely unaware of how serious flu can be. I was aware of it. I knew there were vaccines against the flu, as well as a lot of other vaccine preventable diseases. I have always vaccinated myself, my family, my children. Unfortunately, because it was the H1N1 strain, the pandemic strain of flu that Joseph had, the seasonal flu vaccine that year did not provide protection against that. And actually, 2 weeks after Joseph died, the monovalent H1N1 vaccine came out. And I was standing at a local clinic with my 7-year-old daughter to get that vaccine. So I have a sad story. Unfortunately, my sad story is not unique. Over the course of my own advocacy journey for the past 13 years, I've met a lot of families just like mine that have been impacted. And I think that's why, today it's both my personal and professional goal to raise awareness and help empower people to make informed decisions about vaccination for themselves and their families. Next slide, please.
Charisse?
Yes.
Yeah, just one thing. Thank you so much for sharing that. And I'm seeing in the chat, folks are acknowledging and we appreciate the story. One thing, if you can speak a little closer to your mic, I think Zeke is having a harder time hearing and wants to make sure that folks who are listening on the Spanish channel are able to hear your story as well as sharing.
Sure, will do. I apologize. I was trying to keep my soft voice on, but definitely will try to speak up. So thank you, Sonia, for pointing that out. So thank you. And thank you everyone for your condolences. Very appreciative of that. I know my story is sad, but I share it with you just so that you understand my journey. I certainly know more about flu 13 years later than I ever wanted to. But again, my mission is to personally and professionally, hopefully prevent other families from having a story like mine. So let's jump in and talk about what is flu. So flu is a respiratory disease caused by flu viruses. So influenza A and influenza B are the types of flu that affect humans, and the circulation of these viruses every year are what we refer to as seasonal flu. And we'll talk about seasonality a little bit later in the presentation. But seasonal flu vaccines help protect us against these circulating viruses. So flu is not just a bad cold, even though I know a lot of us have heard that. We go into the store, we see a lot of over-the-counter products for cold and flu. We need to differentiate that flu is not the same as a bad cold, something completely different in terms of viruses. And unlike the common cold, flu infections can lead to secondary complications like pneumonia, and they can also cause significant damage to other organ systems like our heart. So even though flu is traditionally thought of as a respiratory disease, those secondary complications can be quite problematic for people. So many people will get flu and recover. That is absolutely true. And that's a good thing. But when we're talking about severe outcomes like hospitalization and death, it's important to understand that we're all susceptible, right? It's difficult to tell who might recover from flu and who may not. And I say that again as someone who is an advocate and has met a lot of families and individuals like mine who have been personally impacted. So when we talk about those folks who are particularly high risk for influenza, we're talking about people like young children, pregnant individuals, older adults, and people with chronic medical conditions like diabetes and asthma. Next slide, please. So how does flu spread? Flu can spread through tiny droplets that get released into the air when someone coughs, sneezes, or talks. And scientific research has actually shown that these tiny droplets can travel as far as 6 feet. So if we think about when we sneeze, right, and hopefully we're covering our mouth, doing the elbow cough or using our hand, we know that we can project those tiny respiratory droplets quite far. So flu viruses can travel that way. Flu viruses can also live on hard surfaces and objects for up to 48 hours. So sometimes, this is certainly less frequent, but touching a contaminated surface or object and then touching your face, such as your eyes, your nose, or your mouth, is another way that we can be exposed to flu. And research on flu transmission has also shown us that someone who is sick with flu, is generally capable of spreading that to one or more people. So that's why it's so important when we say, if you're sick with flu, stay home. We say the same thing about COVID and other, infectious diseases. That's why it's so important, because we want to stop the spread or reduce it as much as possible. Next slide, please. So what are the symptoms of flu? It can be hard to tell the difference. We have so much stuff going around right now, right? We have heard this season people say things about a triple-demic, where we were dealing with COVID and flu and respiratory syncytial virus, which is also known as RSV. It can be really difficult to tell the difference because so many of these respiratory diseases have many of the same symptoms. So common symptoms of flu can include fever, cough, sore throat, runny or stuffy nose, muscle and body aches, and tiredness. People may also experience vomiting and diarrhea, although those symptoms are commonly seen more so in children. And one of the things that I think is important to note about flu is the sudden onset of symptoms. That can be very distinctive. In fact, a lot of people have mentioned to me, oh, I got the flu, and boy, it feels like I got hit by a truck. It just really wipes them out. So when we think about these symptoms, these are troublesome, certainly. But in terms of emergency warning signs, right? Like, when do we, as patients, think, gosh, this is serious enough that I need to seek medical attention? So some emergency warning signs of flu in children can include difficulty breathing, bluish lips or face, chest pain, dehydration, and a fever over 104 degrees Fahrenheit. Similarly, emergency symptoms in adults can include difficulty breathing, chest or abdominal pain, dizziness, dehydration, and severe muscle pain. The Centers for Disease Control and Prevention here in the United States recommends consulting a medical provider for any symptoms that are severe or concerning. And in terms of testing, there are tests available that can tell us if someone has flu, COVID, or something else. Most of those tests have to be given at a doctor's office, a pharmacy, or a clinic. They are looking at new products that would allow consumers or patients to walk into their pharmacy and get an over-the-counter test. But there is one test that just recently was authorized by the U.S. Food and Drug Administration, but unfortunately, we don't have those things in market yet. So if testing needs to happen, it is important, again, to determine treatment. It's best to reach out to a trusted healthcare provider, a pharmacist, a clinic, something of that nature. And we will touch briefly later in the presentation on flu treatment. Next slide, please. So how many people are affected by flu every year in the US? As you can see by the numbers in this CDC graphic on the slide, it's a lot. In the US, every year, on average, there are millions of flu illnesses, hundreds of thousands of flu-related hospitalizations, and thousands of flu-related deaths, including, on average, over 100 children who lose their lives to flu every year here in the United States. So the CDC data in this graphic are based on the burden of influenza between the seasons, I should say, 2010 and 2020. So before the COVID-19 pandemic, and we know how terribly impactful that pandemic has been. Before the COVID-19 pandemic, flu was actually the deadliest vaccine preventable disease here in the United States. And during the COVID-19 pandemic, flu activity was actually lower than pre-pandemic levels. And that was because of mitigation measures. So during COVID-19, we were doing things like social distancing, masking, we saw school closures. So the flu seasons that we had during 2020 and 2021 were relatively mild due to those mitigation measures. Next slide, please. So how bad is this US flu season? The graphic that you see in front of you, again, those are CDC data. And again, the past two seasons prior to this one were relatively mild. However, flu this season decided to make a reappearance. We have seen flu activity this season that has been closer to levels we saw before the COVID-19 pandemic. So what CDC does every year, they've done for the past several years, I should say, is throughout flu season, CDC is looking at surveillance data and they're putting out preliminary estimates on the burden of influenza in terms of how many illnesses, how many medical visits, how many hospitalizations, and how many deaths. And again, those estimates are based on several monitoring systems that are in place within the US. So if we look at this graphic here, we can see that just between October 2022, and March of this year, 2023, we've already seen a really significant number of illnesses, medical visits, hospitalizations, and deaths. And unfortunately, we've also seen to date this flu season, 132 children have lost their lives here in the US to flu. So flu deaths in children are tracked a little bit differently in that they are a nationally notifiable condition. What that means is when a child dies from flu, it is reported to a local or state health department. Those data are then shared with the CDC, and that's where those estimates come from. And the CDC actually has been tracking pediatric flu deaths since 2004. And sadly, since that time, there have been over 2,000 children here in the US who have lost their lives to flu. And unfortunately, about half of those children were otherwise healthy, just like my son Joseph. And most of those children, upwards of 80 to 90% of them, were not vaccinated. So again, really important when we look at the benefits of flu vaccination, which we're going to talk about in just a moment. And also when we look at the impact of flu in the United States, specifically in terms of severe outcomes like hospitalizations, we also see that flu causes a disproportionate impact on communities of color. Next slide, please. So when is flu season in the US? Flu doesn't always like to follow a trend, but when we look at the data, these are the trends that we see in terms of flu can start as early as October here in the US, and it can last as long as May. And in fact, last flu season was particularly unique because we saw flu activity all the way into June, right? So as shown on this graph, again, these are CDC data, flu activity generally peaks between December and March. So what we'll see many times is there will be a wave of influenza A, which is referring to H3N2 or H1N1, followed by a wave of influenza B. So again, when you see one flu season, you've seen one flu season. Flu continues to be unpredictable, which is why prevention is so important. Next slide, please. So what is the annual recommendation for flu vaccination in the US? So here in the US, the CDC recommends annual flu vaccination for everyone 6 months and older, with a rare exception. So this includes children, adolescents, adults, pregnant individuals, older adults, age 65 plus, people with chronic medical conditions such as diabetes and asthma, and healthy individuals. So just because someone is young and healthy doesn't mean they can't suffer from severe flu. I've heard too many stories of young, healthy children and adults being hospitalized or dying from flu. The good news is that annual flu vaccination is the best defense against flu every season. So all available flu vaccines in the United States help protect against 4 different flu viruses that may be circulating. So why is it important to get a flu shot every season? Because flu viruses can change. And every year, flu vaccines are updated to be protective against those circulating strains. Also, it's important to get a flu shot every year because that flu shot that we got maybe 2 years ago is not going to protect us for this season. And there's a lot of things that may go into that, but one of the things is just our protection wanes over time. It lessens over time. The farther we are away from that vaccination point, our immunity can wane, it can lessen. So again, that flu shot that we got 2 years ago, unfortunately, is probably not going to help protect us this flu season. Next slide, please. So let's talk about the benefits to getting an annual flu shot. So number 1, vaccination significantly reduces your chances of getting sick with flu, or worse, ending up in the hospital or dying. The Centers for Disease Control and Prevention here in the US just released preliminary estimates of flu vaccine effectiveness for this season, and it actually was quite good. Those data showed that children and adults who got a flu shot were much less likely to be hospitalized compared to children and adults who did not get a flu shot. So likewise, vaccinated individuals were much less likely to also visit a doctor or an emergency room for flu-related reasons. So number 2, flu vaccination helps prevent or at least slow down the spread of flu within our communities. So the more people that are vaccinated, the less flu can spread. This is generally referred to as herd immunity. Sometimes we call it community immunity. So not only when we get vaccinated ourselves do we have the benefit of protecting ourselves, but we're also helping to protect people around us, including our friends, our loved ones, and our families. Number 3, since flu is more than just a common cold, its symptoms can cause us to miss school, work, even fun times with family and friends, right? And nobody wants to miss out on stuff. And we recognize that missing school and or work for some people can lead to other problems, like financial burdens. And getting sick can also lead to unwanted medical costs or healthcare costs. So number 4, like all routine vaccinations, annual flu vaccinations are one way we can stay healthy and lead long, productive lives. Next slide, please. So how safe are flu vaccines? So flu vaccines have actually been around for a very long time. They have been safely given to hundreds of millions of people here in the United States over the past 50 plus years. And research on flu vaccines over the years have determined that flu vaccines and their ingredients are safe. Just like other vaccines, flu vaccines are consistently monitored for safety by the Centers for Disease Control and Prevention and the US Food and Drug Administration here in the US. And any safety issues that arise related to vaccination are investigated accordingly by medical experts, public health experts, and scientists. Next slide, please. So let's just touch briefly on some data. So how many people get a flu vaccine every year? It's a little bit different. I think the take-home message here is that we can do a little bit better. So every year, only about half of the people in the United States get a flu vaccine. And you can see here on the slide, looking at these CDC data for this season, that Black and Hispanic children have similar coverage rates, but there are significant differences for these populations when we look at adults and pregnant persons. So the goal for flu vaccination here in the United States is 70% of the population. And we know, looking at these numbers, that we're significantly below that goal. And what does that mean? It means that this leaves us, the people we love, and our communities at risk from flu. Next slide, please. So where can you get a flu vaccine? There are plenty of flu vaccines available, depending on where you live. As shown on this slide, vaccines are offered at doctors' offices, pharmacies, clinics, local health departments. Sometimes you can even get a flu vaccine at an urgent care center or other non-traditional places like community centers or places of worship. If someone is underinsured or uninsured, there are also immunization services available for those people. Federally qualified health centers, rural health centers, and even some health departments offer flu vaccines. And federal programs like the Vaccines for Children program here in the US offer free flu vaccination to children who qualify. So there are also state level programs that are available. So if you look at the two links that I have at the bottom of this slide, the first one is a way to simply find a vaccine. And I believe still you can punch in your zip code or your address, and you can find either a COVID vaccine or a flu vaccine. So throughout the flu season, CDC actually maintains that site, and they make sure that flu vaccines can also be located using that tool there. And the second link at the bottom of this slide helps navigate people to find nearby health centers. Next slide, please. So to wrap up, here's how we can all fight flu, right? Let's think of it as a stepwise approach. Number one, first and foremost, most important, get a flu vaccine each and every year. Number two, practice healthy habits. That includes washing our hands, doing the elbow cough, staying home when we're sick. Number three, get tested if needed accordingly, because that again helps determine treatment. And number four, I see the numbers are a little bit off on this slide. I apologize on the formatting. But number four is there are flu antiviral medications available for flu treatment. So these are things that need to be prescribed by your doctor or trusted healthcare professional, but these flu antiviral medications have been found to perhaps lessen the severity, and the length of flu-related illness. But ideally, and this is really important, flu antiviral medications ideally should be taken within 48 hours of the onset of flu symptoms. So in conclusion, I just want you guys to take away the message that flu can be serious for anyone, regardless of our age, our gender, our lifestyle, race, ethnicity, health status. We are all at risk, but the good news is that we can do something about it. We have the tools to prevent and fight flu, and that helps keep us, our loved ones, and our communities healthy. So with that, thank you so much for your time and attention. And now I'll turn it back over to our friends at Outreach Health Partners. Thank you.
Great. Thank you so much, Therese. Thanks for sharing your personal experience as well as your professional knowledge. I think we got a really good overview about the flu and the importance of the flu vaccine. Just a reminder to folks, we will have a Q&A. I'm sure you have a lot of questions for our guests, so we will have that near the end. So if you have questions, you can put them in the chat box now. You can write it down to yourself right now. And, get ready when we do have the Q&A. Either way, we'll be monitoring the chat box as well. So given all of that, what we've learned so far, we see how important it is really to promote to get the information out there, as well as promote the flu vaccine. And we know how effective outreach and what important role outreach can play in that. So what we're gonna do next is I want to turn this over to Laura, who's going to speak a little bit about the role of outreach, some barriers that we know a lot of the farm worker communities face, and some strategies that we can use really to effectively reach these communities. So Sylvia, if you wouldn't mind advancing the slide. And I think I'm going to turn over to Laura. Thank you.
Thank you, Sonia. So for this next section, we'll be focusing on outreach in terms of strategies for flu vaccine promotion among farm worker communities. Next slide. So let's start off with some background information. In the period between 2021 and 2022, less than 50% of US adults received the flu vaccine. And vaccination rates among farm worker communities are more difficult to estimate due to lack of official and inclusive monitoring. However, these communities may be at greater risk of contracting the flu, given their exposure in both working and living conditions. Moreover, many farm workers fear the impact of the flu as it relates to work and loss of wages, developed symptoms, and limited access to care or treatment when necessary. Next slide. Okay, so while vaccines offer protection against the flu, there are several barriers that exist in obtaining vaccines among farm worker communities, and these may include time. Sometimes clinic hours may conflict with working hours, or workers may not be able to take time off to go to a clinic to get a vaccine. Related to this, there may also be limited access to healthcare providers, and this includes a lack of reliable transportation to and from clinics, and also the uncertainty of the cost associated with the flu vaccines. There may also be limited information circulating about the flu vaccine and its importance. And related to this, also a lack of campaigns and community promotion to highlight the benefits of receiving a flu vaccine. So we recognize that you all have vast experience working with farm worker communities. And so we'd love to hear from you all regarding any additional barriers that you may have encountered in your work. If you'd like to share, please enter your responses into the chat and we'll share them out. Okay, I'm seeing language is another one. Definitely. Transportation, fear. Cost, having no insurance, yes. Lack of information. Okay, language and lack of information, immigrants, time, and fear, trust. All right, Well, thank you so much for sharing those additional barriers. Those could definitely be added to this list. Next slide. Great. So we talked about some of the barriers that exist in obtaining the flu vaccine. So now we'll talk a little bit about outreach strategies for reducing those barriers and promoting the flu vaccine. So first, it is important to provide flu shots at convenient times and places. For example, there might be a mobile clinic that comes to the work site and offers vaccines during work hours. But in order to make that happen, it is essential to cultivate relationships with the growers so that they may facilitate on-site vaccination efforts. There may also be a use of social media or radio communications to promote the flu vaccine campaigns and send out constant reminders about getting the vaccines. Strategies may also employ plain, simple language to provide information and combat misinformation. And this point is very important as one can remain mindful of the varying levels of health literacy in the community. Next are appropriate messengers. These may be community health workers who are able to deliver information in both a linguistically and culturally competent manner. And then lastly, it's very important to learn from what already exists in terms of public health campaigns in countries of origin. And this is an excellent transition to our next speaker, Dr. Laszlo, who will be talking about Mexico's seasonal flu vaccination strategy. Thank you.
Great. Thank you, Laura. Thank you very much. Both of our former speakers here have made my job much easier. Usually I cover these topics and they did such an excellent job with it. So first of all, mucho gusto, bienvenido a todos. Voy a hablar en inglés, pero si usted tiene alguna preguntas, puede preguntar en inglés o español también. So I'm going to need to speak English here and use our wonderful interpreters. But if you guys have any questions, I understand a lot of Spanish, but unfortunately, my Spanish is not that great. But I'm going to talk about the vaccination program in Mexico. And one caveat is I don't work in Mexico. I'm a family physician in South Central Pennsylvania. And for the last 25 years, I have worked with migrant farm workers, many of them from Mexico and the Northern Triangle. And I know they have various states of vaccination or lack thereof. And so I do have some experience there myself, but much of the information I have here is from colleagues who do work in Mexico. So I want to start off by saying all the things that you heard about the vaccination programs and the importance of them are true to my experience as well. For the last 25 years, not only in outpatient medicine as a family doctor, but as a part-time hospital doctor working in the intensive care unit, I've seen the results of unvaccinated people, both influenza and unfortunately with COVID as well. My group has just completed in our 260-bed hospital, the 5,000th patient who was treated with COVID. And certainly there was a lot of death in the last 3 years from COVID. But as one of our former speakers just said, influenza has kind of come back again. And we saw the results of hand washing and social distancing and all of the things that we could do to avoid viral spread was true for influenza. And because we were doing this for COVID, we were able to manage both those diseases with some of the preventive measures. But thankfully, there's vaccinations for both COVID and influenza. So let's speak about the vaccination program in Mexico. The vaccine itself this year was about 50% efficacious to prevent people getting sick enough with influenza A to come into the hospital. And although I've treated many influenza A in the hospital between Thanksgiving and Valentine's Day, the drop has been dramatic over the last couple of weeks into March. And we have yet to see a lot of the influenza B coming through. But the Mexican strategy is a little bit different than the United States in that the populations that are targeted are not everybody over the age of 6 months. It does include the patients who are 6 months to 5 years, and then over 60 and pregnant women, but it does not include the general population between the age of 5 years and 60 in general, unless they have some other health issues as well. So the flu immunization is available for free in Mexico, and it is often used, but not as much as we'd like to see there in the United States. The vaccine is available through government clinics and through campaign events, also available through some private health providers. Certain populations or groups are prioritized, like I said, to start with the flu vaccination at the beginning of the season, which is usually in October. The non-prioritized populations may have access to the vaccine later on in the season, but once a minimum vaccination coverage is achieved with priority groups. So again, the goal had been 70% coverage, just like in the United States, but this is the priority populations we are talking about, which are the children aged 6 months to 5 years, adults 60 and over, pregnant women, health workers, and people with immunocompromised status. The goal has been to reach 70% coverage of these vulnerable populations by the end of 2022, and then 100% coverage by March 31st of this year, which will be just over a week from now. So these are the populations that are being targeted, but like I say, it's not for everybody. Next slide. So what are the types of vaccines that are available? As mentioned before, we have the quadrivalent vaccine in the United States, which are 4 different types, 2 of type A influenza and 2 of type B. In Mexico, it's a trivalent flu vaccine, which are 3 types, which are including both types A that we have in the United States and 1 of type B, which is the Austria version. The one that we don't have is the Phuket Yamagata lineage, which we have in the United States, but we don't use in Mexico at this time. So that's one of the differences. The type of vaccine, trivalent instead of quadrivalent, and also the target population is a little bit different. So this is important to keep in mind when you have patients coming across the border. So when I see patients coming from Mexico into South Central Pennsylvania, I ask them, do they have the flu vaccine? And if not, I'll give that to them. And if I know that they're in that special age group that they weren't qualified because they weren't particularly vulnerable, I would give them the vaccine at that time. If they got the vaccine already, the trivalent, I will not give them the quadrivalent vaccine on top of it. Next slide. So the 2022 to 2023 vaccination campaign against influenza was organized every year between October and March. So this year was October 3rd, 2022 to March 31st, 2023. Next slide. The first available vaccines were designed for healthcare workers. Then vaccination sites are established at health centers as well as secondary and tertiary facilities. There are sites also available at strategic congregation places such as shopping centers, parks, places where people tend to come together. Mobile brigades also ensure that coverage can be received at daycare facilities, adult care facilities where people over 60 tend to hang out. Prisons and other group facilities like mental health facilities, detention centers, and reintegration programs. So these are the vulnerable targeted populations. Next slide. So how did we do in Mexico by the end of the year? Remember, the goal was 70%. It appears that it was done very well, and 74.6% coverage by December 31st. So the end of last year, the goal was reached that over 70% got vaccinated. The data for March 31st, 2023 is not yet out. I was really trying hard to get some kind of information from the people I work with, but that result hasn't been finalized yet because we still have another week. But I'll try to get that information to you sometime in early April. Next slide. So the areas where the goal was met by 70% or exceeded 70% are the red areas. And so you can see that's Baja California, and then down in the central area near Mexico City. Also in the Yucatan Peninsula, Quintana Roo, Campeche, Tabasco, and the middle areas there still are under or below goal of 70% altogether. But generally, most of the areas, the largest populations were vaccinated. Next slide. So these are the references that we have here, and I'm going to put something into the chat here. So one of the interesting stories that came out at the end of last year was that the Undersecretary of Health for Mexico was recommending that the people between the ages of 15 and 59 not get the vaccination, the flu vaccination at this time, but wait till all the other vulnerable groups were protected. So this is one of the stories, and I have met the Undersecretary. He's a very nice guy, very smart doctor, but this sounds kind of out of place. But the reason he's telling you this in December of 2022 is that he was trying to save the vaccination program for the most vulnerable first, and then when those are completed, then the other groups can also come and get their vaccinations. Dr. Hugo Lopez was also one of our board members several years ago, and I'm really happy that he's leading the charge there. But it does seem kind of out of place that he would ask millions of people not to get the flu shot. But that was the reason why, because they were not the most vulnerable. Interestingly, Mexico has 67% of its population in the workforce age group between 15 and 59. So they have a wonderful, strong workforce, but the 67% are the ones that, unless they have an immunocompromised condition, do not qualify for the first round of flu vaccination. Rather, it's the 60 and over and the kids 5 and under. And those represent about 33% of the population. And those are the priority at this time. Again, Mexico is a little bit different than the United States, but not different from parts of the world. I'm not going to cover other countries, but there are European countries who do the same kind of thing, that take the very young and the very old, and then the pregnant women, and then the immunocompromised, more vulnerable, and health workers. So that's a different strategy. But again, it's important to remember, if you have a patient who comes to the United States from a place like Mexico, to be aware of the situation and to vaccinate appropriately. So I'd be happy to answer questions later on, but I'm going to turn it back to Laura at this time. And I've been looking forward to the Q&A session at the end here. Thank you.
Great. Thank you, Dr. Laszlo. If you want to go to the next slide. So I just want to put this in context. Thank you so much. That was really important. And one of the reasons we did want to have Dr. Laszlo here was first of all, to really understand what other kind of flu campaign efforts are going on around the world, but also to help, you all are out there doing outreach, you're in the communities, and with your different outreach strategies. Something that we've been getting some feedback around is really now maybe considering what folks from in their countries of origin, what they are used to, what they're used to hearing, the information that they're given. And so in this case, in this example, you had this message around, hey, there's this priority population first, you got to wait here. and to just kind of keep those things in mind. As you are planning your outreach and sharing this information around the flu and the flu vaccine, as well as, some people maybe are used to having these, as Dr. Laszlo showed, these different flu vaccine events, and they may not be as similar to what we do here. And so folks that you're all seeing here may be waiting for those kind of events and not seeing it here and thinking, oh, I guess, we're not getting this information. Maybe it's not the time when the vaccine is available, all of this kind of stuff. And so we just wanted to think about that, as well as the other outreach strategies that you all are very aware of and as well. So, we want to give you all a chance to think more about the stuff that we've shared today, talk to each other. And so we're going to do some breakout activities. And so just, before we get into that, we have some questions for you all to think about as you are in conversation with each other. But just some last things to consider, again, remembering when flu season is, when some of that, peak happens. So, considering those kind of things in terms of your timing, when you do outreach, determining who are your good partners, who can help you with the outreach that you are doing. And those, for example, can be maybe the growers, the employers. Remembering that there is information, but thinking about how best to get that out there and anticipating those challenges that we see. There is some misinformation out there, the availability of vaccines, as well as we understand folks have hesitancy and have these real barriers that we talked about. Next slide. So this is what we're going to do. We're going to break you up into groups. They will be a group for Spanish only, and we'll stay in the main room. But for other folks, we're going to break you up in a group, about like 6 or 7 folks. And we're asking that you, within the group, designate someone who can be a note taker, as well as willing to report back when we come together. And we just want you all to have conversations around these 2 questions. The first one is really, given these barriers and considerations that we've discussed and what you all know as you do the work in the communities, what are some strategies or methods you have found to be successful? And what are those challenges that you see that still remain? So we're going to break you all up into these different breakout rooms. You'll have about 10 minutes. You'll get like a little message telling you when we're going to bring you back, and then we'll come back as a group and spend about maybe about 10 minutes and share back what you all discussed. And then we'll move to the Q&A with our guest speakers. We're going to shorten a little bit about the time for the report back. Maybe we can hear, I think we all came in, we heard a little bit from Maria, but I'm wondering if there's a group, maybe one group that wants to share some of the stuff that they discussed during their breakout group. You can unmute you can raise your hand if you want and unmute yourself. Anyone?
I'll go ahead without raising my hand.
Okay, sure. Thank you.
Hi, my name is Erendida and I am from the Monterey County. And I was very pleased to meet my partner. We ended up having so much stuff in common. We are both community health workers, and I work with the agricultural workers. And the barriers here that we have are mainly the language, because there's a lot of dialect language. So what we have done is we try to reach out to those to the women that have the dialect languages and also speak Spanish. And what they do is they join us when we go out and do outreach and so forth, so that we have our translators. It's still difficult because, there's not so many there's a lot of them that are shy, but I mean, we're starting to, we don't want to give up. So I think that would be one of the barriers that we struggle with the most, because a lot of people get scared, because they don't know if they don't really believe that we're from a nonprofit organization. Sometimes they think that we're immigration or we're, and so we can't let them know that it's okay, they're okay with us. So that's just mainly what it is with us. And it was nice being here. Thank you.
Thank you so much for sharing that. Yes, we understand the barriers around fear, as well as also language stuff. And so it's so important what the work that you all do, because you are building a presence and connections within the community. Okay, the last question, I think, Isabel, we see you. I see your hand up. Do you want to share what your group discussed?
Yes, I'll try to be brief. So some of the successful strategies have been partnerships and coordinating with other programs, agencies, other who are trying to reach out to these communities, using the use of promotoras or promotores, working with the local health department, and also partnering, which was stated early, actually, partnering at events like food distributions. Those are some successful strategies, and some remaining challenges is the misinformation, afraid of getting sick once they get vaccinated, job restrictions such as time loss or approval of their supervisors, cost, time, and that was it.
Great, Isabel. Thank you for sharing that. Yeah, we know that this is a lot, so we can't do this alone. So the partnership, I think, is really important. At the same time, you mentioned like the challenge of like misinformation out there. And I think a lot of that, we've seen that also with COVID coming about, like the side effects that happen when you do actually get the vaccine. So I think a lot of the some of this focus in terms of doing the health education, getting that information out there is really important as well. Sorry to cut this a little short. I want to thank everyone for being engaged and sharing what is happening in the work that you're doing within your groups. We really appreciate that. With the remaining 5 minutes we have here, I want to give you all a chance, because we have our guest speakers here who have a wealth of knowledge and experience. If you have questions for them, any questions, we have the next 5 minutes to get to those. And I'm wondering, Yvette, did we have any questions in the chat box? I have a question that for the speakers as well here.
I don't see any questions in the chat box, but folks, feel free to unmute and ask your question out loud.
Okay.
Sonia, one thing I want to mention in our group, Alfonso Rodriguez mentioned this, that some places you have to be very careful in the United States where influenza vaccine is supposed to be free, but in certain places it's not, or there's a charge at certain community health centers. And I've experienced that myself at Migrant Clinicians Network. People complained that they thought they were going to get something free, but they are paying something out of pocket. So it's not always free. You got to watch out ahead of time. So I wanted that to be mentioned before we break up, that it's not always, it's theoretically free in most places, but you have to be careful and ask ahead of time, because some places it's not quite free. So just want to mention that. The other thing I want to mention before we break up is thanks to all the interpreters. I really appreciate that. I know I tend to speak really fast and scientific language and all that, and it's really hard to keep up. So I do appreciate the excellent work of our interpreters. That's it.
Thank you for mentioning it. Thank you to the interpreters. We know this is like a lot of information, and thanks for being here and doing that simultaneous interpretation. We know it's not easy. Other question, I think a question that we also had was around, the symptoms. We talked about there's flu, there's a cold, there's COVID, all of this, and it seems lots of times the symptoms seem to be very similar. So in that case, what do you all see as kind of the best approach to address that when like questions around that come up? And this could be for Cerise, this could be for Dr. Laszlo, Lauda.
Well, I can answer from the hospital perspective. In the last couple of years, thanks to COVID, we have now a nasal swab that it put in the patient right in the emergency room once, and we test for about a dozen or more viruses at the same time. This came about because years ago we tested children for RSV, we tested the adults for influenza, and often with COVID, we're testing people 2 or 3 times with a nasal swab, and they were not too happy. So we were able to get a single nasal swab for testing all these different viruses. And so that has helped us distinguish between parainfluenza, metapneumovirus, RSV, respiratory syncytial virus, COVID, and influenza A and B. So that's the easy answer right there. If you're in the hospital and you're in the ER, you might be able to get that. For the first couple of years, where we had the Delta and the original COVID, loss of smell was one of the things that distinguished COVID from everything else. Nothing else really made you lose your sense of smell, unless you had a sinus congestion that was came from something else. But if you lost your sense of smell, that was one of the distinguishing marks for this is COVID and not the other things. But with the newer Omicron variants, XBB 1.5, I think it's no longer as prevalent. So it's not an easy target now to say, okay, if you lost your sense of smell or not, whether it's COVID or not. So we kind of lost that with this last variant of COVID. But those are some of the answers, but I know other speakers had more information on that too.
So it's like really hard to tell, right? And so the testing is where you can get more accurate diagnosis of it, but it seems like it's hard to tell.
Yeah.
I see several questions coming up here. I'm sorry. So I see we have several other questions coming up here. But before we get to that, I know if folks need to leave, they need to leave. If just lastly, if Sylvia, if you can advance to the last slide. There's, we have an evaluation and it's really important that we hear from you all. So we will also put the link to the evaluation in the chat. So if we can, there's also a QR code, which should come up on our slides there as well. So you can also use your phones to click onto this. Yeah, so I just want to stress that we'd love to hear back from you. Sorry that we did run out of time. Can we just take one last question? Yvette, I know I see some in Spanish here. Or
Sure, I translated it to English. Julio was asking if there is a way to get a free community flu test.
got it.
And then Feli also has a question, and what happens if a person from Mexico gets the flu vaccine in Mexico and comes to the US and gets the vaccine in the US? Does anything happen? If Cerise or Laszlo, Laura want to jump in and answer any of these questions, feel free to unmute.
Since I'm not a clinician, I think I'm going to defer to Dr. Laszlo to answer those questions.
Okay, thanks, Cerise. You provide such great information altogether. So I don't believe anything bad is going to happen if you get double vaccinated. I have not, in my experience the last 25 years with hospitalized patients, never had anybody come in with serious side effects from having accidentally double vaccinated for the flu. In fact, some people have gone in September to get their first flu vax, and they got really nervous that it was like February, March, and the flu season was just coming around at that later date, as we were told before. Sometimes it comes in May, June, and they did get a second vaccine on purpose, and we have not seen any side effects there. So I would not be worried about that. My practice is not to give a second one. If we got the trivalent vaccine from Mexico, the quadvalent only adds a little extra influenza B. And that usually comes later on in the year. In fact, knock on wood here, we have not had a whole lot of influenza B yet, which usually has started to surface right around March of the flu season. But I think it's fine to have the trivalent and just that missing part of B. But if I see maybe B getting very strong, then that might be something to consider. It's not a practice that's recommended, but I don't think there's any harm if it happens accidentally that somebody gets double vaccinated.
Great. Thank you so much. So we're going to wrap up here. I'm sorry we did run over. Thank you so much to all of you who are still here. Thanks for participating today. We'll send you out, you'll get access to the slides, any other resources that we do have. And I want to say a special thanks to our guest speakers, to Cerise, to Lauda, and Dr. Laszlo. Really appreciate this. You shared your wealth of knowledge with us, and it was really helpful. And I want to thank again NCFH for organizing this. Really appreciate this. I think it was really valuable information, and good luck with all the outreach that you all are doing. And thank you for all the work that you do. So with that, I think we're going to conclude for today. Thank you, everyone.